It is time now for our KSAT Q&A, where we will be speaking with the mayor shortly about the local latest numbers in COVID-19 and some really eye-opening stats when you heard the numbers that he shared with us today.
Yeah, 9 new deaths and one person in his 20s. That's one of those things that certainly grabs your attention when he's talked about. So we're going to talk to that. Let's welcome him in right now. Mayor Ron Nirenberg joining us. Mayor, I've got to be honest with you. We've seen these daily briefings. I don't know that I've been hit as hard as when you said there are 9 new deaths and then you gave the ages.
Yeah, I mean, this is a stark reminder that this virus doesn't discriminate, and no one is immune from it. And there's a lot to be known about a virus. Again, we call it the novel coronavirus for a reason. There's still a lot to be learned about how it behaves and who it affects, and clearly it's affecting people of all ages in our community.
Earlier in the week, during one of the daily briefings, you mentioned that the acceleration in cases appeared to have been slowing down. Are we seeing any real signs of improvement locally?
It's mixed, and so no one should really draw any long-term conclusions about this, and we've been clear about that. But clearly, starting in second week of June or so, we saw an incredible acceleration of cases, not just in the case rate itself, but also in hospitalizations. Over the last couple of weeks, in particular, since we've kind of seen the mask order now take effect, we're starting to see a slowdown in the rate at which people are being admitted to the hospitals. It's still increasing, but not at the rate it was before. And today, for the first time in a long time, we actually saw a decrease in the number of people in the hospital. We saw severity increase, so more people on ICUs and ventilators, unfortunately, but we did see a fewer number of people in the hospitals, barely, but it's better than where we had been over the last couple of weeks.
So where are we headed right now? I mean, we've talked in the past about stay home, work safe orders. I mean, Fiesta, when you think about it, isn't that far away. I mean, when people are looking ahead to some of these major events, let's take Fiesta, for example. Yeah. Is Fiesta in danger now that the Texas State Fair has been canceled? And I saw Mala Luna was canceled today that takes place in October.
I mean, we have to be realistic. And one of the places that is most difficult to manage in terms of spread of this virus is when you get a lot of people together congregating, and that's those big events, and those are very difficult to manage, and they cause a lot of spread. Unfortunately, it's not just one thing. There are a lot of places where this can happen, and in fact, we're hearing a lot of virus being spread from household to household within the home. So for instance, if people feel like they shouldn't go to a restaurant, don't have 5 people over for dinner that don't live with you, because that's where a lot of this virus transfer is happening. And so, we've got to be mindful of the fact that there isn't just one place, there isn't a smoking gun with regard to where this infection is coming from. It's out there, it's in the community. And so wear your mask, maintain physical distance, don't congregate in close places, and certainly don't gather in large groups. These are very simple things, and we've got to do what we can from a regulatory standpoint to make sure that we don't put people in harm's way.
Mayor, can you stay with us for one more segment? We've got a couple more questions we'd like to ask you. Okay, we're taking a quick break. We'll come back.
We are back with Mayor Ron Nirenberg answering some questions about the latest COVID-19 numbers here locally. Mayor, I want to go back to the issue of Fiesta, just so that we are clear. Sure. It's hard to plan anything right now, but is there a timeline for when an announcement could be made about whether Fiesta is actually going to happen this fall?
Yes, I'll have an announcement on Fiesta within this week. So we'll be meeting with them, in fact, ongoing, and so we'll have an announcement this week.
You talked last week about the fact that what you were hearing is a lot of this spread was coming from people who know they're sick, people who have symptoms and are either going to work anyway or visiting people anyway. Is that still a trend that you're seeing when you talk to Metro Health?
That it's always a risk because the symptoms of coronavirus are often we associate with things like allergies or indigestion even has been linked to coronavirus. So the point is familiarize yourself with coronavirus, with COVID-19 symptoms. And if you have any of those symptoms, don't just assume it's something else. Take precautions. And certainly, regardless of symptoms or not, but especially if you have any kind of symptom, make sure you're not exposing yourself to other people. Wear a face mask, maintain physical distance, etc. That's why it's so important that we behave as if the people we come in contact with already have it. We've got to maintain that posture so that we slow down the spread of this virus.
The city made a change to the offering free testing this week, offering it now only to people who are showing actual symptoms and who don't have insurance. Talk about the status of local testing through the city and where we are right now with that.
Well, and let me be clear. If you are asymptomatic and you just want a test to be, just for peace of mind, it's probably not going to be a wise use of the test. You can still get a test, though. You just need to go to one of the private labs, your doctor, et cetera. You can still get a test if you're asymptomatic. There are 3 locations, though, the mobile pop-up sites in Freeman Coliseum, where we have testing for free, specifically for people who are, that's the only place where they can access it. If they don't have insurance, they don't have a doctor's order, they don't have an appointment, you can come get a test. But we want to make sure that the people who only are able to get a test from those sites have them. So let's make sure there's a reason to get a test. If you have any kind of symptom, if you believe you've been exposed to someone who's had COVID-19, you can get a test at Freeman or the mobile sites without an appointment. Walk up, and we want to make sure that those are there. The point of all this is we want to ensure that everybody who needs a test gets a test, and we can do that as long as they're distributed in the right manner.
Are we seeing any of the lag times in getting these results back that they've been seeing in other communities across the country?
Unfortunately, this is a nationwide problem, and I talk to my peers in the other cities quite often, and they're experiencing the same thing, and it ebbs and flows. Many people in our community, and I would say the vast majority, are getting their tests within 3 to 5 days. It's just normal, and some are getting them faster than that with the rapid tests. But we have heard anecdotes of people waiting a long time because of backlogs in certain labs. And we're trying to cut that down as much as we can and working with the state and federal officials.
Speaking of the testing, kind of staying in that thought process, I've had some people reach out to me saying, okay, why do we see such a dramatic change from one day to the next in positive cases? We may have 1,200 one day, it may be 300 the next, go back up into the 800s the next day. Do you have any explanation as to why there's such a fluctuation? So yes, the testing data doesn't come back uniformly. It comes back in batches. And so quite often, especially over weekends, et cetera, you'll get one day will be down, next day will be up. This is because they're not coming back in, evenly. But this is a really important point. That's reason why it's so difficult for us to determine where we are just by looking at case rates. In fact, you can't. When you look at the daily case rates, you're actually looking back into the past, probably about 2 weeks in terms of the behavior that led to those test results. So we have to look at hospitalizations, which is a much more accurate assessment on a daily basis of the trending of this disease, and take all of these measures, these indicators that are on the website with a comprehensive view of the situation.
Mayor Ron Nirenberg, thank you for your time. We'll see you tonight on the Night Beat at 10.
Sounds good. Thanks, y'all.
We'll be right back.